Hello everyone. In this video we're going to talk about the evaluation of a health communication intervention. This is kind of boring, but it is in fact important. And the fact that it's a little bit boring and tedious is part of why it's so important. A lot of people don't like doing this. But if we do it the right way, we can do it in such a way that it is validating and supportive of the whole enterprise rather than just something that makes us miserable. Now, we must do evaluation and we must do it right so that we can ensure the best outcomes. That's behavioral outcomes and program outcomes. Um, this doesn't have to be tedious, boring, and expensive. We can work smart and not rather than hard. I mean, it's going to take hard work either way, but if we plan accordingly and we do this from the beginning, then evaluation can be a built-in process and it can help you reduce your own uncertainty about the whole process as well. When it comes to this class and what we're going to be expecting for our final project, it's going to be a little more toned down than this, but I do want you to understand this process so that you can apply it in the future if need be. I myself am going through this process on a number of projects. It's just part of the territory when you're a health communications scholar. Um, but in a lot of ways, it's one of the most gratifying parts of the process because we can see our efforts working in action. So I'll encourage you to think about it that way, despite how I started out this video. So the first step is recognizing that this can be done much more easily early on and with good planning, as with everything else. The more you try and wing it when it comes to health communication interventions, the worse your outcomes are going to be and the worse your experience is going to be. So really, this is just more of the same. We're going to begin this discussion in earnest by revisiting an old term. Monitoring is something that we brought up in the last chapter, which was chapter 13, talking about designing and implementing a program. Now, there's a reason for that. It's tempting to treat this as a separate process, but really it should be built into the program design, right? And if we find ourselves picking this up on the back end, well, we're going to be missing a lot of key data because monitoring refers to the collection and analysis of data relevant to implementation and success. And if you're not thinking about success before you start your project, you're much less likely to encounter it. So here are the main areas of monitoring that go into this. One is the issues and context, the news and trends related to your health issue. That includes all that audience analysis, all that the project proposal stuff that we did. That is the initial step, but it continues throughout the process. You need to pay attention to how things are developing. Health is dynamic, just like culture, and cultures around health are dynamic as well. And we need to keep our finger on the pulse, so to speak. That means paying attention to stakeholders, how things are developing in the community, and if there's any new information about, say, I don't know, an emerging pandemic that is developing as we go along. This is perhaps one of the most exhausting parts of the process, is recognizing that you don't become an expert by just like reading one book. You have to stay on the topic and you have to pay attention. I've got a lot of papers saved about COVID-19, and that challenge got very difficult very quickly trying to monitor how that was all going down. Even though I didn't have any official implementations in that program, it's still kind of my job to pay attention to those kind of things. It's exhausting. I've been there. I know. But it's important, and we need to know that we are talking from a position of expertise as to the best of our ability if we're trying to do something as important as change people's health behaviors. Another part of this monitoring process is feedback. That means from key groups and stakeholders. So ideally, if you're following the process as prescribed by the textbook and NIH and all these different entities, you are involving stakeholders throughout, right? So in that sense, this is just checking in with them periodically, checking in with your community partners so you can, again, keep a finger on the pulse of the project as it progresses. Is it progressing as you expected? Is it not progressing as you expected? That would be really good for you to know as you go along, wouldn't it? So that's stressing this participatory framework that we are emphasizing throughout the textbook, as Schiavo is really passionate about, but in reality, that's how it's done these days. This is very much in vogue, and I don't think it's ever going to go away soon. We have developed our public health initiatives over time, and this is going to be part of it because we are trying to help people. Go figure. And so we want to keep them involved. It's a participatory process. Therefore, we need feedback built into our monitoring. That might be meetings, regular meetings with your community leaders. It might just be periodic surveys. I like to collect midterm feedback from my students. That is monitoring. I want to know what's happening as it's happening rather than at the end of the semester when I can't do anything about it. Now, This also stresses the need for process and progress indicators, which we're going to discuss in a moment, what those might look like to your unique program or just in general. And it also includes the collection of summative data. So once that project has been executed, and assuming that it is rolling along and you have some preliminary data, that's when we start getting to the summative data stage. So what are the indicators of success? We need to have a clear picture of that and monitor those as well. And that will help us develop this summative data to be able to clearly communicate with our stakeholders and community, or write a paper, for instance, for an academic journal, how effective this was. So monitoring can be kind of this overarching term describing this important part of the process, including evaluation and success. So what does an evaluation plan look like? It should be developed at the same time as the action plan. It should not be an afterthought. I've mentioned that a couple times already, but it bears repeating. This is part of the planning process. It's not something you do like, okay, project's rolling, now what do we do? That's not when this happens. This should be thought of from the beginning. And I think that the early stages of this are corresponding with those SMART objectives. When you decide on objectives for your plan, that's part of what we're doing. We're evaluating them for realism and practicality, feasibility in terms of cost. All of that should be happening before you set the plan into motion. That's part of this evaluation. So it should be focused on behavioral outcomes at different levels of society. We're talking about health interventions, we're talking about health behaviors, and those can be really hard to measure, actually. It's very difficult in the soft sciences, as we call them, to correspond something like health behaviors to health outcomes. But we have some ways of attempting to do that, and we'll get some helpful tips as we go along here. But we should be looking at behavioral outcomes at different levels of society. That could be the micro level in terms of like individual outcomes, that could be organizational outcomes, that could be community outcomes, that could be legislative outcomes, but we should have some pretty clear intentions as to what is going to emerge from all of this. Something like instituting legislative change can be very complicated to accomplish, or it can be very easy. It could be very fortuitous. A colleague of mine who went through breast cancer treatment and had a mastectomy, discovered that a lot of insurance doesn't cover anything other than breast implants for cancer survivors who have had mastectomy. That's a problem, but she happened to meet someone at the right person at the right party and be like, hey, this is a problem. Our insurance doesn't really cover closed chest, aesthetic closure of the chest. And now there's legislation that's being drafted in the state of Wisconsin because of that. So it could be something as simple as that, but that's not something you can really force. I guess my point is you can't really plan for that kind of thing, though you might get lucky sometimes. When we're talking about health interventions, it's usually a bit more, we want to be more concrete than that. We want to be realistic in our expectations. We can still be optimistic, but we should be realistic. There are a lot of different possibilities when it comes to what an evaluation plan can look like. But it depends on your measure of success. And so this means that collaboration and mutual agreement is critical with all those stakeholders. I am in a collaborative work group on breast cancer in Walworth County of Wisconsin, and we are a community work group. So there are academics like myself, but there are also breast cancer survivors. There are people of all different backgrounds, and we are currently in the early stages of divergent thought, right? Brainstorming. And one of the things that we have to do is establish what success is going to look like for our work group. And it's collaborative, right? So if we don't do that, however, we're going to be going in different directions. Pretty straightforward in that regard. But we cannot forget the participatory nature of this process. This is not just about what Jonathan, Dr. Dellinger, the academic who's interested in health communication, it's not just about what I want. It's supposed to help people, right? And it's participatory in that way. So now, one thing that is important is that once you've established those theoretical assumptions in the beginning, it's best to preserve those throughout the whole program cycle. Don't just change things on the fly, right? Once the program's underway, you want to try and stick with your assumptions. These are good research practices in general. If you've taken research methods, you might be familiar with this. We don't want to change our hypothesis as we're gathering data. we want to test that hypothesis and then adjust it for future studies if we find that it's disproven or not. That's just good practice, but there's reason for that. You want to maintain those theoretical assumptions, otherwise you can get lost, confused, or worse, you could be performing some kind of academic misconduct, and you definitely don't want to be in that boat. Evaluation parameters. What are we actually trying to measure with evaluation? Well, again, we're trying to measure behavioral outcomes at different levels of society as indicators of success. Here's the figure from the textbook talking about that. This could be policy behavior, including policy adoption and implementation, as in my previous example. That can be tricky, but if you've got the right connections, you can make that happen. Social norms and social behavior. Well, that's also tricky, right? Because while culture is dynamic, we can't always guarantee what's going to amount to what in the long run. But social norms and social behavior, if we focus on something specific that's low-hanging fruit, so to speak, and we can leverage that, then we can, in fact, affect social change. Individual and key group behavior. So this gets easier when we're focused on individuals and key groups, and we are paying attention to what they need and want. Because if we are responding and incentivizing change in the direction that they already want, then we're much more likely to see success in that regard. Organizational behavior and practices across different sectors. This is another more meso to macro level intervention, product outcome, but it's possible as well. And if that's what we're trying to accomplish, then we need to be making sure that we are applying pressure to the right sector, right? We can't expect just targeting a few local individuals to translate up to organizational behavior. We have to make sure that we are using the right communication channels, etc. So in thinking through some of the evaluation parameters, that can help us. It's integral to the planning process. We have to do this as we go along, and you can kind of see why, because they're tied together. All right, so 3 forms of evaluation. Really, I've mentioned some of these terms already. Let's see if we can explain and explore them a little bit further so you can understand what some examples of this might look like. We have formative evaluation. We have process and progress evaluation. We have summative evaluation. And monitoring is, in fact, a related process. It describes kind of the process of integrating these things together. So you can use those terms and your imagination to try and guess what these look like, but let's look at some specifics. I'm probably going to skip right ahead to the process evaluation part of this because we have, believe it or not, already talked about the summative evaluation. That has to do with that audience analysis and understanding the health issue, all that research that happens on the front end as we form our program. That would be more of that formative evaluation. Sorry, I said summative. I meant formative. Summative is at the end. The formative is how we're developing that process. That would be the pre-testing. That would be surveying people. That would be doing focus groups to determine what those key groups and stakeholders care about, what they need for this intervention. The process evaluation is probably more what you're imagining when you hear the words evaluation or program assessment. For process evaluation, there are a lot of things we can focus on. For example, the message delivery, the depth, the extent, the reach, all of these different vocal qualities of the message or paralanguage qualities. These are things that we can measure and we can get people's response to. So if we're trying to look at message delivery and we have a focus group ongoing, then we might ask them questions about, well, how easy was this message for you to understand? Do you think you encountered it often enough to be thinking about it? Well, these are the kinds of questions and things that we can evaluate as we go along. Message retention. What time intervals after the event can we measure, say, someone adjusting their attitudes about it? So are they recalling the message? And are they applying it in their life? You can remember back to some of those earlier theories and like the Combe system and all that, and they're talking about not just do they implement the behavioral outcome, but does that persist? Do they integrate that into their life? Well, message retention would be one measure of that, right? We would say, okay, we measure immediately after exposing someone to the message, and then we measure them a month later. So those kind of time intervals, that is a common way of evaluating process as well. I'm writing that into a grant as we speak about trying to measure, an Anishinaabe concept of health and well-being. which is they call it Mino Bimadaziwan, which is a cultural concept. But anyway, as we write that grant, we have to account for, okay, if we get these messages into an app, for instance, and expose people to that, what do we expect to have happen as they progress through time? And can we see that at time 2? Do they still retain that message later on? Participation in an event. This would be another indication that we could use, perhaps depending on your program, right? All these are depending on your program, to measure some form of success. Did you have influential advocates attend? Did you have endorsers? Was your target population there? And if not, well, we might want to adjust our strategies, right, a little bit. So that's another indicator of the process. Distribution of materials, number of follow-up requests. So if you're distributing a pamphlet or something like that and you have a QR code or a phone number they can call, can you measure how many people actually do that follow-up behavior? That would be one way we can evaluate the process and its efficacy. We could also talk about the endorsement from third parties and an ability to create alliances. So can we measure that? If we have a fundraising event, did you get your funds? Do you have people who are interested in your issue, and are they willing to collaborate in future projects? And likewise, the ability to create alliances among those populations. These would be good indicators of a successful program. These are just a few examples of how we can evaluate the process of the program, but maybe that gives you a little bit of insight as to, well, start brainstorming about what that would look like. Now, when it comes to the summative evaluation, what we're really trying to determine is we're trying to measure the extent to which change has actually occurred as intended. We'll talk about some specific ways of doing that in just a moment, but we want to remember that when we're trying to accomplish something like a summative evaluation, it's tricky. We are trying to assess changes in individual community or social behavior, and in order to do that, it's going to require several things. It's going to require intensive effort in concentrated geographic areas and time periods. That means we have to be focused with our intervention. We can't just throw it out to the wind and expect everything to work out, right? It's also going to take front and back and market research. So there is overlap with advertising and marketing in this regard. This may mean tracking surveys. That may be an entrance survey and an exit survey, like I described with, like, if we have a health app. Okay, well, what were people's attitudes before they were exposed to the app? What were their attitudes after? We need to be able to measure that in order to know if we have any success. We can also have other qualitative and quantitative measurements built into, say, the app itself. We can have other surveys built in. We can have focus groups, again, to touch base with the key groups and stakeholders to see what's going on. Now, it's also going to take significant financial commitment. When we're talking about these kinds of projects, we're usually talking about grant-funded or non-for-profit efforts. And they do take financial commitment because you need to pay people for their time, you need to pay people for their effort. And that's what a lot of government entities, their whole job is to do, is to provide grant funding for these kinds of projects. But we want to also keep in mind that only long-term efforts can generate sustainable behavioral and social outcomes. So it's not usually a one-off thing. It's not as simple as just seeing one poster and that's it. And that's part of the importance of the evaluation in general, monitoring and evaluation. So the summative evaluation is recognizing these limitations of our programs and trying to build them into a longer program of study. That's what happens kind of at the professional level of these sort of health interventions. So how can we specifically link outcomes and the intervention? This is probably one of the hardest parts. Particularly difficult because we're talking about behavioral outcomes. And as I mentioned earlier, we're talking about the social sciences here usually. And even if we're talking about a hard health intervention, it's not as simple as it is in the laboratory. And so it's very difficult to draw causal relationships. There are mathematical and other methodological ways in which we can attempt to do this, but the first step here is recognizing how difficult this is. Now, so how do we know we did the thing? We got to consider the outcomes. We have to consider whether or not the outcomes. So first of all, we want to measure the outcomes. Okay, did this work? Well, ideally, if that's the case, it should coincide with my effort. That means that we wanted it to appear at the appropriate time, And we would like that that outcome. Ideally, if we weren't doing the effort, we would like to see that the outcome or the benefit went away, right? That would be a direct correlation with what we were doing, and we would have good reason to believe that there was a causal relationship at that point. So the most prominent example in my mind as to wanting to make sure your intervention is working and being able to measure that would be non-pharmaceutical interventions for respiratory illnesses. By that, of course, I mean in the COVID pandemic, there were a variety of masking mandates, and they were touted to be reducing caseloads and things like that. Well, one of the common criticisms of that is that we don't know. We can't tell when we implement a mask on the back end of a natural curve. So this graph, what you're seeing here is, this happens to be Ottawa. It's just one of the first ones I found, Ottawa, Ontario, or Ottawa, Canada. What you see here are respiratory infections. These are influenza, the normal curves, how they normally go. They spike in flu season and then they peter off, and this is across years. And so adding mask mandates has been claimed to make a difference here. Well, here's a comparison of COVID rates. What you want to pay attention to is down here on the bottom. You see, again, a fairly normal distribution, exactly what you would expect according to the spread of respiratory infections over time. Don't worry about this cumulative number of cases over time. It looks like it's climbing all the way up. But what's important there is that it does kind of plateau after a while. That also we would expect with any kind of respiratory infection. So the trick is, if your, for instance, mask mandate is instituted on the back end of this curve, right around here, you are not going to be able to measure if it has an effect or not. And so that's a problem with your health intervention, right? And there have been some very pointed criticisms against how that went down, specifically in the state of Wisconsin. This is demonstrated through some pretty basic epidemiological analysis to be the case. Mask mandates came into effect while we were plateauing in terms of the total number of cases. And so it's impossible to claim success from that because we simply do not know. It is impossible to tell statistically. But that's an example of a problem that would emerge from a bad evaluation program. And if not bad, a worst case scenario would be it's a deliberately misleading one, but I am going to reserve judgment about that. But at least we can see that this is a complication that we have to deal with. Here I've just shrunken down those graphics so you can kind of see a little bit closer to the scale what we're talking about. The vertical scale is not correct, but the horizontal scale is accurate. And so that's that follows pretty normal distribution, exactly what you'd expect to see. It makes it hard to measure. So if our outcome, if our effort is working, then we would want to see it appear at an appropriate time, and we'd want to see the effect of that, the benefit of it would go away if we remove the intervention. We want to see if our outcomes were predicted. Did it go as we expected, or did it not? Did it demonstrate a proportionate relationship with our efforts? So the harder we try, do we see better outcomes, right? We would want to see a proportionate effect. These are some examples of how we can measure this and perhaps start to draw a causal relationship between our intervention and the outcomes. Importantly, we also want to be aware of possible alternative explanations. And so that's what we're talking about here. Could it be explained by more compelling alternatives? That's what the textbook is referring to as the contribution analysis. So when it comes to our final projects, I'm going to ask you to identify potential confounding factors. Like, well, if this is the outcome, what would be something else that might affect that based on your analysis? So assume you have the desired effect. Is there a possible alternative explanation? I know we're using a couple layers of imagination there, but it's really, really important for us to be able to measure these things. And in interest of keeping this video short and concise, there's a lot to talk about in this chapter. Feel free to dig into it, and you probably should. But hopefully this gives you a general overview. And at the very least, we can kind of conclude with these thoughts, recognizing that linking outcomes to the intervention is a little bit more complicated than it seems on the surface. And that's why we want to have evaluation programs set from the beginning of the planning process. Well, there you go. I hope this helps you out a little bit. We'll reconvene again soon as we wrap up the semester. Thanks for your patience. Take care.